ancient medical practices that were just torture in the marble halls of ancient healing temples, where physicians claimed divine knowledge and medical practitioners wielded bronze instruments in the name of restoring health. There existed a dark truth that challenges our understanding of ancient medicine. Many procedures that were considered advanced medical treatments were in reality systematic forms of torture that caused more suffering than the diseases they claimed to cure. This is the investigation into the hidden history of ancient medical practices that crossed the line from healing into harm, where good intentions and primitive understanding created a world of medical procedures that were indistinguishable from deliberate cruelty, and where patients seeking relief often found themselves subjected to treatments more horrific than their original ailments. Today, we examine the archaeological evidence and historical records that reveal how ancient civilizations developed medical practices that, despite being conducted with genuine therapeutic intent, amounted to systematic torture disguised as healing arts. Our investigation begins in ancient Egypt around 3000 BC, where the Edwin Smith Papyrus and other medical texts describe surgical procedures and treatments that demonstrate both remarkable anatomical knowledge and techniques that would be considered extreme by any modern standard. Egyptian physicians developed sophisticated methods for treating skull fractures that involved drilling holes directly into patients' heads using bronze tools. With no understanding of infection control or pain management beyond crude herbal preparations that provided minimal relief. The practice of trepanation, or drilling holes in the skull, was conducted on conscious patients who were restrained during procedures that could last for hours, as physicians slowly bored through bone tissue to relieve what they believed was pressure on the brain. Archaeological evidence from Egyptian burial sites shows skulls with multiple trepanation holes, indicating that some patients survived initial procedures only to be subjected to repeated drilling sessions as physicians attempted to treat ongoing neurological symptoms through increasingly invasive interventions. Ancient Egyptian dental practices included extraction procedures that involved gripping teeth with bronze forceps and using twisting motions to remove them from patients' jaws, often breaking surrounding bone and causing massive infections that were more dangerous than the original dental problems. The treatment of broken bones in ancient Egypt involved setting fractures using wooden splints that were bound so tightly they frequently cut off circulation, leading to gangrene and limb loss that physicians considered acceptable outcomes if the bone healed properly. Moving to ancient Greece around 500 BC, we find that Hippocratic medicine, despite its reputation for establishing ethical medical practices, included treatments that caused extraordinary suffering in the name of balancing bodily humors. Greek physicians practiced bloodletting on a massive scale, regularly draining patients of several pints of blood to treat everything from headaches to heart conditions, often leaving patients so weakened that they died from blood loss rather than their original illnesses. The Greek treatment for mental illness involved restraining patients in wooden devices that immobilized them for weeks or months while physicians attempted to shock them back to sanity through exposure to extreme temperatures, loud noises, and deliberately frightening experiences. Archaeological discoveries at ancient Greek medical sites include restraint devices and surgical instruments that reveal the extent to which patients were subjected to procedures that prioritized theoretical medical goals over patient comfort or survival. Roman medical practices, despite their reputation for advancing surgical techniques, included procedures that demonstrated remarkable disregard for patient welfare in pursuit of anatomical knowledge and surgical precision. Roman physicians developed cataract surgery that involved pushing the clouded lens into the back of the eye using sharp bronze needles, with patients fully conscious during procedures that frequently resulted in permanent blindness, severe infection, or death from shock. The treatment of battlefield wounds in Roman military medicine included cauterization procedures where red-hot iron brands were applied directly to open wounds to prevent infection, with patients held down by multiple assistants while their flesh was systematically burned. Roman dentistry included procedures for straightening teeth that involved filing down healthy tooth structure with abrasive stones and binding teeth with metal wires that frequently cut through gum tissue and caused severe oral infections. In ancient China, traditional medical practices included acupuncture procedures that involved inserting needles deep into patients' bodies at locations determined by philosophical theories about energy flow rather than anatomical knowledge, sometimes puncturing vital organs and causing internal bleeding. Chinese physicians practiced a form of surgical procedure called opening the channels that involved making deep incisions along what they believed were energy pathways, with patients remaining conscious during procedures that often severed nerves and blood vessels. The ancient Chinese treatment for mental disorders included imprisonment in small wooden boxes that prevented movement for extended periods, combined with exposure to extreme heat and cold that was believed to shock patients back to mental balance. Ancient Indian medical practices described in early Ayurvedic texts included surgical procedures for removing kidney stones that involved making deep abdominal incisions without effective anesthesia, with patients restrained during operations that frequently resulted in death from shock or infection. Indian physicians developed techniques for treating eye diseases that included scraping the surface of the eyeball with sharp instruments to remove what they believed were disease-causing deposits, often destroying patients' vision in the process. The ancient Indian treatment for epilepsy involved drilling holes in patients' skulls and inserting heated metal rods into brain tissue, based on theories about releasing evil spirits that were believed to cause seizures. Mesopotamian medical practices included treatments for internal disorders that involved inserting metal instruments through natural body openings to manipulate internal organs, with no understanding of sterile technique or the risk of causing internal injuries. Babylonian physicians treated digestive problems by forcing patients to consume large quantities of mercury-based preparations that caused severe poisoning symptoms that were often worse than the original stomach ailments. The ancient treatment for broken ribs in Mesopotamian medicine involved binding patients' chests so tightly with leather straps that breathing became extremely difficult, often leading to lung infections that were more dangerous than the original injuries. Archaeological evidence from ancient medical sites throughout the Mediterranean reveals surgical instruments that appear designed more for causing controlled damage than promoting healing, suggesting that many procedures prioritized theoretical goals over patient welfare. Ancient anesthesia techniques relied primarily on alcohol consumption and herbal preparations that provided minimal pain relief while often causing additional medical problems, including liver damage, respiratory depression, and allergic reactions that complicated recovery. The practice of using human and animal waste as medical treatments was common across many ancient civilizations, with physicians prescribing remedies that regularly caused severe infections and poisoning symptoms that exceeded the severity of patients' original conditions. Ancient surgical procedures were conducted in unsanitary conditions with instruments that were rarely cleaned between patients, leading to infection rates that made surgery a virtual death sentence for many individuals who might have survived their original injuries or illnesses. The psychological impact of ancient medical treatments often included lasting trauma from procedures that patients experienced as deliberate torture, creating mental health problems that ancient physicians had no ability to recognize or treat effectively. Modern medical historians studying ancient treatment records have identified patterns of patient mortality that suggest many medical interventions killed more people than they helped, raising questions about whether these practices represented genuine healing attempts or systematic harm disguised as medicine. The development of ancient medical education systems created institutional structures that perpetuated harmful practices across generations of physicians who were trained to prioritize adherence to traditional methods over observation of actual patient outcomes. Archaeological analysis of ancient human remains shows evidence of medical procedures that appear to have been conducted primarily for the education and experimentation of physicians rather than for the benefit of patients who served as unwilling test subjects. The legacy of ancient medical practices that crossed into torture demonstrates how good intentions, combined with primitive understanding and lack of accountability, can create systematic harm, even within institutions dedicated to healing and helping others. As we examine the archaeological evidence and historical records of ancient medical practices, we gain important insights into how the pursuit of knowledge and the desire to help can become corrupted when not balanced by genuine concern for patient welfare and systematic evaluation of treatment outcomes.